So welcome to Live Doctors. We're here with Dr. Derek LeRoith, who is Professor of Diabetes and Endocrinology at Mount Sinai Hospital in New York City. We're talking about type 2 diabetes and obesity, and we've had a nice discussion about a lot of different issues that someone who might be at risk of diabetes or have diabetes ought to know. Dr. LeRoith, going forward, you've done some incredible groundbreaking research, is my understanding, looking at the potential connection of diabetes and cancer, which is sort of a scary idea. I mean, as if diabetes isn't enough, that there can be a connection with cancer. Can you tell us a bit about your research and other related research, and what is all this telling us here?
So there's a large amount of epidemiology showing that in various countries, whether it's the Western countries, whether it's in the Asian countries, that obesity and diabetes, type 2, has an increased risk for developing most cancers. Furthermore, there's an increased mortality. In other words, the outcomes from, if you have diabetes or obesity and you develop cancer, you're more likely to have a poor outcome from the cancer. And this has been shown in many different studies, and the real question is, why should obesity and or diabetes affect cancer risk or cancer outcomes? And so we've been looking particularly at breast cancer, and we look at both animal models and we have some human studies in New York. And what it looks like is that the metabolic syndrome, this pre-diabetic phase where you have this high insulin, which is not working very well on the metabolic tissues, can actually drive cancer cells. And so we've been interested in understanding how insulin can work on a cancer cell when it can't really work on a metabolic cell like the muscle or the adipocyte.
Interesting.
And we have various ways of blocking it and working through the system to understand that. There's also epidemiology that in the same system of metabolic syndrome, a high cholesterol also drives cancer cells. And so we have animal models that can look at that as well. And when I say we, I mean we and others are working on this particular aspect.
So that's fascinating. So if I'm hearing put it simply for a layperson, diabetes type 2 is a syndrome where there's resistance to insulin, so the body's insulin levels go up, and the elevated insulin and the proteins that are involved in producing insulin seem to drive cancer.
Right.
And then the other sort of double whammy, if I'm understanding you correctly, is that people with diabetes tend to have metabolic syndrome, which is a high cholesterol state, and that's also shown to drive cancer. So there's these two forcing factors, the cholesterol and the high insulin.
And there are other factors as well. We don't believe that the cholesterol or the insulin in the obese or type 2 patient are the only driving forces. They seem to be the major forces. Remember that in these diseases, there's also an inflammatory component. So cells like the adipocyte make inflammatory factors like cytokines, which come out and also drive the cancer. So they're all working in concert.
I hear. So what you're saying then is the adipocytes, which are fat cells, they also produce chemicals called cytokines, which are pro-inflammatory chemicals, and that generates or pushes the system towards cancer as well. Would you say that adipocytes are more likely to produce these inflammatory chemicals in people with diabetes and high cholesterol?
Yes. So remember, these are obese individuals with or without type 2 diabetes, and the adipocyte seems to also be abnormal in that situation. There's an inflammatory infiltrate, certain cells like macrophages, and all of this together gives off these bad cytokines that can then affect the cancer growth.
Interesting.